Welcome everyone who's tuning in today, to our viewers out there. My name's Dave Boyle. I've been in the occupational healthcare industry for over 15 years now, and I'm thrilled to have the opportunity to discuss Occ Health in general, where it's going, the innovation, where it's come from, and a whole world of great insights with Dean Mohr, the founder of Body Care, an innovator in the industry, and a founder of My Occ Health Record, something which has just hit the market. We're really keen to unpack today what it includes, what it can do, and how it can help the industry as a whole. So welcome, Dean. Great to be here with you today. Really excited for the chat.
Hey, Dave. Good to be here with you today.
Great to be here with you as well. There's a whole lot of other factors in occupational healthcare which maybe aren't so commonly discussed. Keen to try and unpack those a little bit with you today. So over the years, Dean, you've made a living from supporting organisations to reduce injuries, mitigate risk, reduce their premiums and claim costs. But I think today more than ever, it's probably a really pivotal point, a pain point of organisations out there. And I'm keen to understand how the system supports that. How is it designed from an injury management and claims perspective to support these skyrocketing claims we see in today's environment?
It's been hard over the last 20 years to watch the state workers' comp schemes fall into more and more debt. When we talk to our clients, their premiums are growing exponentially. They're trying what they believe is everything they can to reduce the risk of injuring employees. The average cost of a claim is spiraling out of control, and we're dealing with a lot of mental health claims today. Again, very hard for employers to manage, very hard for the system to manage, and we look at our clients and we say, right, how can we design something? What is it that's going to move the needle? How do we support the current system that exists to enable the insurers to be able to reduce premiums and organisations to be able to reduce the number of claims they have that come through their system? Part of what we're really focusing on is this idea of hire to retire. And I do keep talking about it. And why? Because no one has done a good job to date in being able to bring together the data, the longitudinal health data across sectors, around individuals, related to age groups. We talk about this aging workforce. Oh my God, for 10 years, that's all I ever heard about. No one knew how to deal with it. And it's because we've never had the data. And that is why we want to ensure that we can build this and we can create this ecosystem that enables the data to feed into one place. Because once we understand the data, we can start implementing more injury preventative measures to reduce claims and costs associated. How do we do a better job of mitigating the costs of that injury? And there are lots of different great businesses out there that help work with the industry bodies to bring those costs down. How do we understand the data better? You may not think it today, and most organisations don't. It's a tick and flick. We've done the right thing. We've given you, David, a moment in time view of what your health looks like. That's not the way health looks. If we're going to improve health, we need to understand, what did your health look like yesterday? And then what's it going to look like in a year? And then what's it going to look like in 5 years? So imagine this scenario. This was one of my visions when we started building this software. Imagine you started working for a company today and you had I'm going to use a basic variable, a basic stat, and you had your blood pressure taken and your heart rate taken. And then after the first year, you've got to do some sort of assessment, a periodic, and they take your pulse and your blood pressure again. And then 2 years later, they do it again. And you've been at that organisation, you're loyal, and you've been there for 10 years. And then you have a test. And you think about where the world's going to be in 10 years from now and the importance of data and artificial intelligence. When all this data is sitting in one place, to have the ability for this system to inform you, hey, David, based on these outcomes over the last 15 years, we think you're at serious risk of a medical condition that is serious. And imagine we saved your life.
I'd love to get my head around some of the customized workflows and the automation, which I know the system can do. I've been lucky enough to work for a number of the largest providers in the marketplace who have different terminology, different ways of delivering systems. And I understand from a client perspective or an organization in the marketplace that has to comply with regulation, they have to do commercial drivers' medicals, cold board medicals, silica medical assessments, a periodic medical of a nature. They're with a provider, say provider A, for a number of years, and they decide to make a procurement decision to move to a new provider. It might be a growth, efficiency, cost basis. When they move to that new provider, they find everything's done differently. The terminology is different. There might be some statutory guidelines behind the scenes, but there's different ways of booking, different phone lines, systems to use, communication channels, results portals, you name it. There's a huge amount to unpack from provider to provider. And while they all offer benefit, the organization unfortunately has to manage that change. And that change is fairly large for a number of organizations, especially when you're running a lean business. Can you talk to me just a little bit about these communication workflows that can be built, some of the automation possibilities within the system?
Every company seems to want to do something different. Very challenging for a provider. And so what we've gone about doing is building this system. So if you imagine again, we're selling this system into a organization and enabling them to create their own workflow. Then we want to make sure that the outcomes of those questionnaire feed through to a doctor, so the doctor can see it, or a physio, or to a drug lab, or to a occupational specialist, occupational physician. There are so many different workflows that exist. No company does it the same. So what do we think about when we're designing this? The back end of the system, if you think it's built for the company, enables organizations, logistics company A, to design whatever workflow they can. We're going to start with an SMS to say, please click on this to do a questionnaire. And literally you can plug in every single part of this workflow all the way to the end, right? To the outcome of that assessment. Our system has been built with a full back-end workflow system that enables organizations to set up every layer of that. So if information's not coming back, the next day it gets followed up by the system. It sets reminders. So if you're meant to have a rail cat every 3 years, or a heavy driving test every 2 years, or whatever it may be, you might be a pilot and needs to have a medical every year. Every year, at the right time, it'll send a reminder out to the client. Now, typically in organizations, that can be seen as a negative from an employee's point of view. Companies watching over me, they want to do testing on me. Hearing testing is a great example of that. Oh, we're going to do hearing testing again, it's annoying. Imagine turning that into a positive. Hey, David, you're due for your biannual hearing assessment, which we did 2 years ago, and we do this to make sure that your hearing is still in good condition. We're not damaging your hearing, and that you're fit to go to work and and we're doing the right thing by you to protect you. So you're going to get a message tomorrow that we want you to click on to help book that appointment, and that will create the workflow and you'll get booked in. So this whole system has been built to be able to create these opportunities for organizations to speed up and manage the way they run the health of their employees through from hire to retire.
And I'm keen to talk on another fairly critical pain point, which I've seen time and time again. The role of a chief medical officer is a tough one. When you talk about a huge, diverse, distributed workforce operating miles or hours out of capital cities and remote mine sites, offshore oil and gas rigs, how does the system help a chief medical officer out there in today's world have the information in real time and make governance decisions? Is that even a thing? Is this a world where a chief medical officer would use the software, or is this only for a health and safety representative and an employee?
Let's put the chief medical officer hat on. Often they are the chief decision maker. We agree?
Absolutely.
Yeah. And so that often means in most workflows or assessments, they sit right at the end of it, to make the critical decision that needs to be made. They are the source of truth.
Absolutely.
If anyone knows, they know.
Well, they're ultimately responsible largely.
Correct. So if I go back a step, and I've spoken previously about the workflows, let me sort of just play you through what an assessment feels like for an individual.
Yep.
I'm going to company X, and you turn up day one you turn up to have your assessment done. You fill out a questionnaire. The doctor logs into the system. All the answers to your questions are sitting there in front of the doctor. All the red flags in the system are sitting there. There's governance around that. So if you've said your age or what medication you're on, it will pull that out and provide a summary to the doctor to make their life easier as they start their assessment. They then go through their tests. It has a whole layer of clinical governance over it, so you can't put the wrong information in at any point. You can't put blood pressure 300 over 200. It'll pick it up in 2 seconds as an example.
Yep.
Stop the test. It'll do those things. You go through your full assessment, through the workflow. At the end of it, it gets to the occupational physician, chief medical officer, whoever it might be in an organisation, and they log in as the last user. They get an alert, sees it on their dashboard. They get to see the files they need to go look at. All the information is sitting there in one place. And the best part of it is that there's no information missing. So as you go through your assessment, unlike paper, which exists, and you think about services like, I know with cold board medicals, it's a challenge. Sometimes there's so much paperwork. Sometimes a piece of information gets missed through an assessment. Very, very important to capture it all. But if you think about it, you get to the end of it, all the information along the journey is required to be inputted to be able to get to that final point. Otherwise, the assessment doesn't progress. Chief medical officer opens it up. It's all sitting there for them to be able to make the decision they need to make. So when you talk about governance, there's no information missing. The system's ensuring there's clinical governance over the information that's going into it, and they get to ultimately make that decision with all the power they need, which is the information they've got in front of them. That makes sense?
It does, yeah, powerful.
Yeah.
What does the system do to secure information from a data security perspective, reduce cybersecurity risk? Tell us what the system can do.
I'm not the engineer, but I'll tell you everything that I know. We've laid in, first of all, we're ISO 27001. We've been IRAP assessed, which is government assessed effectively, past all those security measures. No easy feat to get IRAP assessed, so we're pretty proud of that one. Effectively, when you think about health data, often when we think about systems that hold health data, I always think about practice management software. You walk into a clinic, your name comes up, I want to make an appointment for Dean Mohr, goes in here, what company do you work for? Mohr Health Record. David comes in, what company do you work for? David Enterprises, and you're just filling in boxes. Now, what happens to that data is it's all sitting in what I call one bucket, one tenancy, where all that information is sitting. That's fine, except the risks that come with that are, what happens if you're an employee for BHP and I go to my drop-down box for the company you work for and I push Rio Tinto, and through a system, when the assessment's done, the manager, through a practice management system, the manager receives an email, because it's built into the system who the manager is, for David Enterprises, just because someone at the front desk clicked the wrong button by chance.
Human error.
That is a disaster. Now, let's be honest, it happens. But in the world of data security and protecting health information of individuals, that's pretty bad. We talk about, things that happen to Optus and breaches and all these things. In the world of health, that's really bad. It happens. And that's on one individual, by the way. Imagine you're getting a monthly report as the manager at Rio Tinto. You're getting a monthly report, and just by chance, the drop-down box, someone's checked that when they set you up, you're the manager of BHP. But it's got your email address as the Rio Tinto email address, and all of a sudden you get a BHP report sent through to Rio Tinto. It happens. So that is what we worked to avoid. And that is what you call everything sitting in a single tenancy. So our platform is a multi-tenanted platform. What does that mean? It means that your information, David Enterprises, and all of your workforce, they're sitting in one tenancy in this cup over here. My data is sitting in that cup, and they never cross. The data never crosses. And where it sits way back, it's fully encrypted. But in essence, we're trying to build a system that protects people's health data, because what we know is that today we live in a world where maybe we'll get away with it if we muck it up, but we're planning for the future. And the future needs to look like that everybody is protected and their health data is protected. And the government is very, very strong on that right now. So that is what we've gone to build, to protect employees' health data and not share it with those that should not be getting it.
Impressive. I think in all my experience, I've never met a medical organization nor a technology organization operating in the medical space which has achieved an IRAP accreditation. So congrats.
Yeah.
Impressive stuff. No small feat. I can only imagine the hoops that needed to be jumped through to attain that. And so there's authority limits for different personnel and organizations to have different access levels. The recruiter at a low end who's trying to book 300 people for a pre-employment isn't seeing the in-depth medical data that the chief medical officer is reviewing at an end.
Absolutely. So the whole system's built up with, there's a different user interface for the medical practitioners that get in, that log into the system. There's a different user interface for the client that logs in. But from an administration point of view, absolutely. It locks you down to what you can see depending on your role. And if you think about what the system covers, right, the breadth of areas across an organization it covers, the recruiter, they should only be able to see a name, maybe, and a phone number, a little bit of information sitting up the front here, right? They might want to track how a pre-employment is going. They can see a tracking system for the pre-employment, where it's at. But when you get to the chief medical officer, they need to see the raw data. Absolutely. And so they're going to have different user access at that point. But the head of HR, they might want to see aggregated data across all the sites across the country. So their user profile enables them to see aggregated data rather than really what's going on with David, which may not be relevant at that level. So it enables the different layers in an organization to be able to use the data as they need to, but also it enables them to be able to take that data and present it up the line in their organization, which we know is important to them succeeding in their role as well.
Yeah, absolutely. Yeah. And I think one of the coolest functionalities, it has a lot of value in it, but it's a sensitive medical. Who are the organizations coming in? You can't escape company policy. Even if you're the managing director, the CEO, you're stepping into one of the largest organizations in the country, you're still required to undergo a medical. 100%. 9 times out of 10, you're still going to have to turn up. You're going to have to do your questionnaire, sit in the waiting room like everyone else. We're all human here.
We're here to solve a problem that hasn't been solved and to make life easier in a very complicated space. We've continually disrupted and tried to innovate in a world that needs innovation.
I love this idea of an ecosystem. I don't think anyone's actually provided a solution back to any clients in the marketplace to run an ecosystem of providers. And I'd be the first to say it. Some providers are specialists in some areas and other in different areas. And it's certainly a really challenging thing from a provider perspective to own and operate clinics on every square block corner, which is just down the road from said organization. So how does an organization go about bringing different providers into an ecosystem? Can they plug and play with any provider around the country which they want? And can they change one provider to another provider should it be an injury or a health surveillance or a pre-employment medical?
Plug and play. You just said 3 words that are critical to this system. And that's exactly what we've built in this system, this ability for an organization to be able to, as they go on their journey and they decide what testing they want for their cohort, their employees over a period of time, be it today or in 10 years, they can literally drag and drop providers in and out. They can add providers. So think about the idea that, that provider A is providing the pre-employments, but provider B is doing the drug testing and provider C is doing hearing assessments in Queensland, but provider D, E and F are doing hearing assessments in WA. You can invite them all in. It is so easy. It's a click of a button and an invite to invite them in, and they become a user straight away. So when they turn up, when they're doing their assessments, they can just they can literally input the data directly in, and it feeds back into this file. So the whole concept of this is it enables organizations to be able to have multiple providers, which we know they've got now, where their data goes everywhere, to bring it into one place. The other added benefit to organizations is often they need multiple providers, but a tender process doesn't allow an organization to have multiple providers.
So I think AI is a pretty hot topic globally at the moment.
You think?
I know.
I'm really excited about AI. I'm excited about where it can take the medical fraternity. I think it is going to move the needle, and I think it's going to, if we talk about creating healthier employees, reducing risk in a workplace, AI and its ability to understand large data sets could absolutely change that whole narrative about what we and the goal of what we're trying to achieve. So, I think what's critical to that question is ensuring that when a platform is built, it's built to be able to then manage AI functionality. So its layout of its data is done in a meaningful way that it'll be able to be pulled apart in every single way we want. So one of the things we've rolled out really early, we've got this ability to ask more. So a little box where you could ask anything you want. Can you tell me about the most amount of injuries we've got at any site across the country? Oh, can you tell me the average age of these injuries? It's this ability to actually just dive in and ask questions into the database to start getting predictive data out. Being able to ask this data set something when you're seeing problems in your workplace is going to be fantastic.
I agree. As we move towards a world of machines and robots taking a whole lot of roles and responsibilities on, the role of a human is still so important. We still have to protect and look after the health and wellness of each employee out there. AI is going to help us make smarter decisions faster to ensure that we do that in a better way. And so I support that. It's an exciting time. It's great to see that My Occ Health Records thinking ahead of the game already, that clients that are potentially onboarding will get the benefit down the track as well.
Powerful.
Absolutely.
And that is the power of data. And that does not exist now in occupational health. And why I love occupational health, because occupational health data is driven by employers paying for people to have assessments, their employees, because they're doing it to mitigate the risk of them getting injured in the workplace. They're paying for that. So that data is able to be collected and utilized. Right now, the data is everywhere.
We've got an aging workforce, a blue-collar workforce that don't often go see their GP. So organisations are trying to be proactive in that sense. Let's have a health check of some description. And for years, they've been company funded. There were some great initiatives in the state of Victoria around healthy heart checks and those sorts of things, which were government funded for a long time. These organisations now have reached a level of maturity where they understand that the greatest beneficiary of a happy and healthy employee is the organisation. We spend so much time at our workplace working for these organisations, and now the duty of care is there, that they're collecting this information. How do they use it in a meaningful way to help these ageing workforce, blue-collar workers who otherwise wouldn't have had an intervention or a health checkup at that point in time? And I guess My Occ Health Record is a way to do that.
If we think about our objective, it's always been to ensure people could go to work and come home injury-free. Every time I say it, even 25 years on, it sends a shiver down me because we've done good things. Like, we're not just selling a widget to someone, we're actually having an impact on people's lives. And I know, and so do all the health professionals that work in our organisation, we collectively know that at the end of the week, we can look back and we have prevented an employee from going home who may not have been able to present with an injury at that point due to who knows what, they couldn't share with their manager, we don't know, the opportunity to get on with life. And I've seen the other side of it. The other side of it is that someone has a back injury that they don't deal with and it gets worse and then something goes. And it doesn't just impact them, it impacts their whole life, their family, their children, every part of it. And the fact that the health professionals that work in our organisation can go home knowing they've prevented those things from occurring, I think is pretty fulfilling in the world of health.
Dean, thanks so much for chatting today. It's been amazing to unpack not only your journey from a physio to a tech leader in the industry. It's pretty clear that the occupational healthcare industry is not just about great service. It's about data, insights, efficiencies, and the next iteration, which maybe we're both even not sure what's coming ahead of us. So for all our listeners out there, we hope you've enjoyed the deep dive today, the transformation of occupational healthcare, where it's going, the innovation which is driving it. Certainly exciting from where I stand. It's an industry I'm passionate about. I know you are, Dean, as well. So thanks so much. Let's do it again sometime.
100%. I mean, loved
Awesome.
it. Loved it.